Never rest to sit 2 times. It only can help you. See what I'm saying? So we kind of orient our heart properly, and we can see this interventricular groove slanting from top left to bottom right, okay? And then we talked about how the left side of the heart includes the apex. See this whole big side here? If I put a pin here, it'll be the left ventricle. If I put a pin on this other side towards the top, that will be the right ventricle, right? And if I put a pin on this crack and I ask what's that little line, you say interventricular groove. And because you're holding your heart like this is the anterior side, it means it's like the heart is like inside. Okay? Okay, back to the thingy, camera thingy. So immediately you will see the pulmonary trunk. If you don't see it right in the front, going out like that from the right side, then you know you don't have your heart correctly oriented. Okay? So make sure this is slanting this way, and then this will be the pulmonary trunk. So therefore, this jutting out here would be the brachiocephalic artery. And this here is the part of the aorta curving out. Do you see it? See this whole big thing here is the aorta, you know? So if I wanted to ask the aorta, I would really put the pin on this, and then you say aorta, right? But if I put it on this, brachiocephalic. Okay? All right. So now that we know this is our right side, this is our left side, right? If I put a pin on this auricle on this side, maybe here, I don't know, somewhere. What blood vessel is that?
Right auricle.
The right auricle. Right. This is the right side. What blood vessel would that be? I'll say what blood vessel is that? What? Vena cava. Very good. We've already talked about the brachiocephalic and the aorta, and you've already talked about the pulmonary trunk. And then if I put a pin on this side, on the left auricle, and I ask about the blood vessel, what would that be? Pulmonary vein. You're done, right? That's it. And then you open it up on the inside, all right? Ooh, did I say right exam on yours? Yeah, very good. Sure did. So, even while it is opened, you don't have to keep closing it to tell which is the left and right. Right? You don't have to do that. Because why? You know that the left side is going to include the apex. So this is the left side, all right? You can see how this is the ventricular muscle, you know, and you can see the endocardium, right? It's this grayish lining on it, right? So now that we know this is the left side, what is this valve here? So I'll put a pin on this.
Bicuspid or mitral.
Bicuspid or mitral, very good. What are these cords here?
Chordae tendon.
Chordae tendon. You see this little hump here attached to that? Papillary muscle. All right? And then on this side, if I put a pin on this and I say, what's that valve of the brain, of the heart?
Tricuspid.
Tricuspid. That'll be the tricuspid. And then if I put a pin through this and say, what's that string-like structure? What would that be? Moderator band. So if I put a pin on this or on that, what's this? Interventricular groove. Interventricular septum. Septum. All right? Okay? You can see this is the atrium. Oh, all right? On the left side, kind of going in there. All right? And then the right, it's kind of up here. But anyway, that's pretty much it. What else have we forgotten? Do you see the curvature of the aorta? You see it? Coming out, and you see the hole that goes to the brachiocephalic branch? Do you see that? Yeah. See, I put it in there. Okay? So this is a very nice view of the aorta. So what valve would this be?
Tricuspid. No.
Semilunar valve. Yes. I might just ask that.
You might.
Be careful. You see, this valve here on this near the ventricle will be the atrioventricular valve. So this will be the tricuspid, and this will be the bicuspid. But if I go up here, you see this valve here that I cut through? You see it? See the flaps? This will be the semilunar valve. Do you see how the aorta is curving nicely? See? So this will be the ascending aorta, and that's the one that's directly attached to the heart. That was an exam question. And I put aortic arc. The arc is way up here. So what's directly attached? Because multiple choice question is about finding the best answer from the choices given. Not because it was the correct answer in the previous quiz. No. Right? You look for the best answer on the choices given. All right? So that's it, really. That's the heart. It's so simple.